Are you aware of the 10 alarming signs of cirrhosis? You won't believe the most shocking one. Cirrhosis silently affects millions worldwide, especially in America, leading to severe health issues. Welcome to our channel. Today, we're diving into a critical health topic. Is your liver in danger? 10 alarming signs of cirrhosis revealed. Cirrhosis, a severe scarring of the liver from long-term damage, needs early detection. Undiagnosed cirrhosis can lead to life-threatening complications, including liver failure. Don't miss this vital information that could save your life and help you take control of your liver health today. Number 1, fatigue and weakness. Did you know that feeling constantly tired and weak might be more than just a lack of sleep? These are actually common yet often overlooked symptoms of cirrhosis. As cirrhosis progresses, the liver's ability to function properly starts to falter. Remember, your liver plays a crucial role in metabolizing nutrients, detoxifying your blood, and producing proteins that are vital for your energy levels. So, when it's damaged, you might start feeling a significant drop in your overall energy. One major reason for this fatigue in cirrhosis patients is the buildup of toxins in the bloodstream. Normally, your liver filters out these toxins, but when it's not working well, as in cirrhosis, these toxins can accumulate and even affect brain function, leading to that persistent feeling of being tired. Additionally, cirrhosis can lead to anemia, whether from bleeding disorders or malnutrition, which just adds to that tired feeling. Another issue for many with cirrhosis is muscle wasting, also known as sarcopenia. This happens because the liver's compromised state leads to metabolic imbalances that reduce muscle mass and strength. Plus, cirrhosis can make you lose your appetite and miss out on essential nutrients, sapping even more of your energy and stamina. If you're experiencing unexplained fatigue and weakness, it's really important to get checked out by a doctor. While these symptoms can be common in many conditions, they could also suggest something more serious like liver disease or cirrhosis. Catching these signs early and getting the right treatment can make a big difference in improving outcomes and maintaining your quality of life. Number 2, loss of appetite and weight loss. Did you know that a loss of appetite and unintentional weight loss are significant signs of cirrhosis? As cirrhosis progresses and the liver's functionality worsens, it starts to disrupt the digestive process. This disruption makes it harder for the body to metabolize nutrients properly, often leading to less desire to eat because the liver isn't sending the usual hunger signals. With cirrhosis, you might also experience fluid retention and swelling in the abdomen, a condition known as ascites. This can make you feel uncomfortably full, which can further decrease your appetite. Moreover, since a struggling liver can't produce bile efficiently, fat digestion becomes more difficult. This can cause gastrointestinal symptoms like nausea and bloating, making the idea of eating even less appealing. All these factors, the poor absorption of nutrients, reduced food intake, and digestive discomfort, contribute to noticeable weight loss. Cirrhosis can even change your sense of taste and smell, making food less attractive and reducing your calorie intake. This scenario, often referred to as cachexia, involves losing both muscle mass and body fat, which can significantly alter your appearance. Additionally, cirrhosis often leads to metabolic disturbances and hormonal imbalances that can speed up muscle wasting. These changes not only contribute to further weight loss, but also to an overall decline in physical health. If you're experiencing these symptoms, it's crucial to seek medical attention promptly. Early intervention can help manage the effects of cirrhosis, improve your nutritional status, and potentially slow the progression of the disease. Number 3, nausea and vomiting. Are you dealing with frequent nausea and vomiting? These uncomfortable symptoms can be a sign of cirrhosis, indicating that your liver is struggling to detoxify your body and process nutrients effectively. When the liver can't perform its duties, toxins and metabolic byproducts build up in your bloodstream, which can trigger nausea, a condition known as hepatic encephalopathy. This not only causes gastrointestinal discomfort, but can significantly affect your quality of life. Cirrhosis can also lead to a condition called portal hypertension. This happens when there's increased pressure in the portal vein, the major blood vessel leading to your liver, affecting blood flow to your stomach and intestines. This disrupted flow can cause congestion in your gastrointestinal tract, which contributes to nausea. Moreover, ascites, or the buildup of fluid in your abdominal cavity, puts extra pressure on your stomach and intestines, making you feel even more nauseous and often leading to vomiting. Another key issue is the liver's impaired ability to produce bile, which is crucial for digesting and absorbing fats. When your body can't produce enough bile, it struggles to process the food you eat, leading to malabsorption and ultimately more nausea and vomiting. To add to the complexity, some medications used to manage cirrhosis symptoms, like diuretics and lactulose, can also cause nausea and vomiting as side effects. Persistent nausea and vomiting are more than just distressing. They can lead to dehydration and electrolyte imbalances, which can further complicate your health. If you're experiencing these symptoms, it's crucial to get medical help. Proper management and treatment can help address the underlying liver issues and improve your overall well-being. Number 4. Swelling in the abdomen and legs. Did you know that swelling in the abdomen and legs, known as ascites and edema, are common signs of cirrhosis? These symptoms occur because cirrhosis impairs the liver's ability to produce proteins and regulate fluid balance. Normally, the liver makes a protein called albumin, which helps keep fluid in the bloodstream. When cirrhosis reduces albumin production, fluid can leak out into surrounding tissues, causing swelling. Ascites, the term for fluid accumulation in the abdominal cavity, typically stems from portal hypertension, a frequent complication of cirrhosis. This condition increases pressure in the portal vein, the major vessel carrying blood to the liver, forcing fluid out of blood vessels and into the abdomen. This leads to discomfort, difficulty breathing, and a constant feeling of fullness. Ascites can also heighten the risk of developing spontaneous bacterial peritonitis, a severe infection that demands urgent medical care. Edema, or swelling in the legs, happens when fluid builds up in the lower extremities. The same issues affecting albumin production and increased pressure in the portal system contribute to this. Additionally, cirrhosis can hamper kidney function, worsening fluid retention as the body struggles to get rid of excess fluid. Managing these symptoms often involves dietary changes like cutting back on salt and using diuretics to help the body expel excess fluid. In severe cases, medical procedures like paracentesis, which involves draining fluid from the abdomen, might be necessary. Recognizing and treating these symptoms early is key to relieving discomfort and preventing more serious complications linked to cirrhosis. Number 5. Jaundice, yellowing of skin and eyes. Jaundice, which you can recognize by a noticeable yellowing of the skin and eyes, is a key indicator of cirrhosis and points to significant liver dysfunction. This condition happens because of an accumulation of bilirubin, a yellow pigment that's a byproduct of the normal breakdown of red blood cells. Normally, a healthy liver processes and gets rid of bilirubin in bile. But when you have cirrhosis, your liver's ability to handle this task is compromised, leading to a buildup of bilirubin in your blood. When your liver can't excrete bilirubin properly, it starts to deposit in your tissues, causing that characteristic yellow tint. High bilirubin levels not only result in jaundice, but can also make your urine darker and your stools paler than usual, which are telltale signs of impaired bile flow. Jaundice can worsen if there are bile duct obstructions, which might be caused by scarring or inflammation in the liver, blocking the normal bile flow and leading to even more bilirubin accumulating in your bloodstream. Additionally, jaundice can bring about itching, as the bilirubin deposits in the skin can irritate nerve endings. This not only causes discomfort but also serves as a critical alert that liver failure may be occurring, requiring immediate medical attention to tackle the underlying liver damage. Managing jaundice effectively means addressing the root cause of the cirrhosis and keeping a close watch on bilirubin levels. In more severe cases, treatments might include medications to improve bile flow or procedures to clear up bile duct obstructions. Detecting and treating jaundice early is crucial to prevent further damage to the liver and avoid additional complications. Number 6. Itchy skin. Did you know that itchy skin, or pruritus, is not just uncomfortable but also a common symptom of cirrhosis? This itchiness points to the liver's declining function. Normally, your liver processes bile salts and moves them into the digestive system. But when you have cirrhosis, your liver can't do this effectively. This leads to a buildup of bile salts in the bloodstream and under the skin. The itching from cirrhosis isn't just in one spot. It's usually all over the body and can be quite intense, often enough to disrupt sleep and interfere with daily life. This widespread itching is thought to happen because the accumulated bile salts irritate nerve endings in the skin. On top of that, cirrhosis can make your skin dry, which is often due to nutritional deficiencies and dehydration associated with liver disease. This dryness can make the itching even worse. Managing itchy skin effectively involves tackling the root liver issues and may include treatments like bile acid sequestrants, antihistamines, or topical creams to help soothe the irritation. Keeping a close eye on this symptom and getting the right medical care are crucial. They not only help manage the itch, but also improve overall quality of life for those with cirrhosis. Remember, catching and treating liver disease early can greatly lessen the severity of symptoms like itchy skin. Number 7. Bruising and bleeding easily. Did you know that bruising and bleeding easily are not just minor issues, but significant signs of cirrhosis? This condition shows that the liver is struggling with one of its crucial tasks, producing the proteins that help blood clot. Under normal circumstances, your liver regularly synthesizes proteins essential for clotting. However, when cirrhosis damages the liver, this function gets impaired, leading to a shortage of these critical proteins. As a result, people with cirrhosis might notice that they bruise easily, even from minor bumps or sometimes seemingly without any reason at all. This is because their blood vessels are more fragile, and their blood doesn't clot as effectively as it should. On top of that, spontaneous bleeding issues like nosebleeds or bleeding gums become more common, which further underlines how much the liver's function is compromised. Cirrhosis can also cause thrombocytopenia, where your platelet count drops too low, making blood clotting even more difficult. This issue is often worsened by portal hypertension, another common side effect of cirrhosis, which causes the spleen to enlarge and hold onto platelets. To manage these symptoms, it's crucial to keep a close eye on the underlying liver condition and possibly use treatments like vitamin K supplements, blood transfusions, or medications that help improve clotting. Getting timely medical care is essential not only to prevent serious bleeding problems, but also to effectively manage cirrhosis. Number 8. Dark urine and pale stools. Dark urine and pale stools are classic signs that something might be off with your liver, often pointing to conditions like cirrhosis. Here's why these changes happen. Normally, when red blood cells break down, they produce a substance called bilirubin, which your liver processes and excretes in your bile. This bile not only helps digest fats, but also gives your stool its usual brown color. However, if your liver is damaged, as in cirrhosis, bilirubin can build up in your blood instead of being properly excreted. This excess bilirubin finds its way into your urine, turning it a darker color. At the same time, if your liver isn't producing enough bile, or if there's a blockage in the bile flow, your stools might lose their color and turn pale or clay-colored. These symptoms are important red flags. They not only suggest issues with liver function, but might also signal complications like bile duct obstructions or more serious liver damage. Keeping an eye on these signs is crucial because they often appear before other, more severe symptoms of liver disease emerge. If you notice these changes, it's important to manage the underlying liver issue promptly. A medical evaluation can pinpoint the cause and determine the best course of treatment, which might include medications to improve bile flow or procedures to clear any obstructions. Catching and addressing these issues early is key to preventing further liver damage and avoiding more serious complications. Number 9. Spider-like blood vessels on skin. Did you know that those small web-like clusters of blood vessels that sometimes appear on your skin, known as spider angiomas, are a common sign of cirrhosis? These spider-like markings typically show up just beneath the skin's surface and are most often found on the face, neck, chest, and arms. They occur because of elevated estrogen levels in the blood, which happens when the liver can't metabolize hormones properly due to damage. In people with cirrhosis, the liver's diminished function leads to a hormonal imbalance. Since the damaged liver struggles to break down and clear estrogen from the body, this hormone builds up and causes small blood vessels to dilate, resulting in spider angiomas. While it's true that spider angiomas can appear in healthy individuals, seeing them in larger numbers or sizes can be a significant clue that something is wrong with the liver. These markings themselves aren't harmful, but they do signal that there may be underlying issues with liver function. Spotting and keeping an eye on spider angiomas can help catch cirrhosis early. Managing them involves treating the underlying liver disease to correct the hormonal imbalance. This might include medications to manage cirrhosis symptoms and lifestyle adjustments to support liver health. Regular checkups are crucial to control these symptoms and prevent further damage to the liver. Number 10. Confusion and memory problems. Confusion and memory problems, which doctors often call hepatic encephalopathy, are serious indicators of cirrhosis and significant liver dysfunction. When the liver can't effectively remove toxins from the blood, these harmful substances accumulate and start affecting brain function. Ammonia, which is a byproduct of protein metabolism, is particularly troublesome. When it builds up in the bloodstream, it can lead to noticeable cognitive impairments. People experiencing hepatic encephalopathy might face a range of cognitive challenges. These can vary from mild confusion and forgetfulness to more severe symptoms like disorientation and difficulty concentrating. Interestingly, these symptoms often get worse at night and can be accompanied by mood swings, irritability, and poor judgment. The underlying issue here involves disruptions in neurotransmitter functions caused by the buildup of toxins. This disruption can alter brain activity, leading to the cognitive difficulties we observe. Managing hepatic encephalopathy involves several strategies. These include dietary changes, such as reducing protein intake to lessen toxin production, and medications like lactulose and certain antibiotics that help reduce toxin absorption in the gut. Regular monitoring and prompt intervention are key to halting progression and improving life quality for those affected. Treating the underlying liver disease effectively is crucial for alleviating these cognitive symptoms and helping patients regain their mental clarity. What to do if you notice these signs? If you notice any signs of cirrhosis, it's crucial to get medical help right away. Early diagnosis and treatment can make a significant difference in managing liver disease. Don't hesitate. Make an appointment with your healthcare provider for a thorough evaluation. They will perform the necessary tests to pinpoint the cause and start the most effective treatment. Addressing these symptoms promptly can help manage the disease more effectively and improve your overall health. What are the prevention and management? Preventing cirrhosis really comes down to leading a healthy lifestyle. This means avoiding excessive alcohol, eating a balanced diet, staying active with regular exercise, and keeping any underlying health conditions like hepatitis under control. If you've already been diagnosed with cirrhosis, it's crucial to follow your doctor's advice closely. Make sure to take any prescribed medications as directed and keep up with regular checkups to monitor your liver health. These steps can help slow the progression of the disease and maintain your overall well-being. Understanding the early signs of cirrhosis is crucial for maintaining your health. By staying informed and seeking medical help promptly, you can manage liver disease effectively and enhance your quality of life. Don't keep this important information to yourself. Share it with your loved ones to help them stay aware too. And if you found this helpful, don't forget to like, subscribe, and hit the bell icon for more health tips and updates. Together, we can work towards better liver health and overall well-being.